Hey guys, my name is Sam and I'm a doctor based in New Zealand. Today I want to talk all about snoring. What causes snoring? Is it healthy to snore? When should you worry about your snoring? And of course, how to stop snoring. A heads up that I am not affiliated with any particular product, so I will try to give you my recommendation on the best treatments for snoring in terms of the latest research. Please hit me up in the comments as to what you found the most helpful tip. What is snoring? Snoring is a rattling noise made as we breathe during our sleep. Many partners have a personal experience of something like this. It's very common, affecting about 57% of adult men and 40% of women. Of these, 1/4 are regular snorers. What causes snoring? Snoring occurs when your upper airways are narrowed, which causes turbulent airflow. This makes the surrounding tissues vibrate, producing noise. Narrowings can happen in your nasal passages, the back of your throat, and some men have excess throat and nasal tissue, or the tongue can get in the way of smooth breathing. Why do people snore? Just remember that snoring can happen at any age, but it is most common between the ages of 40 and 60. In children, it is usually because they have very big tonsils or adenoids, or their nose is blocked up from a cold. In adults, the most common reason is being overweight. Extra fat tissue in the neck and throat can put pressure on the airways, which leads to snoring. Alcohol, it relaxes the muscles and tissues of your throat while you sleep, thereby making snoring happen. Certain medications, like sleeping pills, can also relax the muscles in your throat to make snoring worse. Nasal congestion. If you have mucus in your nasal passages from allergies or polyps, this can cause snoring. Smoking. In a study of 811 adults, the risk of snoring was more than double amongst current smokers. This may be due to irritation of smoke, which inflames the airway tissues. It is also more common in pregnancy and in women who have gone through menopause. Is it healthy to snore? Snoring once in a while is completely normal. However, it may lead to some abuse from your partner who can't sleep.
We should put a pillow under her head. I think that helps. Good. Much worse. Interesting.
This question really leads on to a more important point, which is, when should you worry about your snoring? Well, if you snore and you also have symptoms of stopping breathing during your sleep for short periods of time, you may have a condition called sleep apnea. I made another video specifically on this topic if you want to check it out. I'll link it in the description. In general, I would recommend you to see your doctor if the snoring is regular and affecting your quality of sleep. Once you know the cause of your snoring, then you can go about getting it fixed. So how do you stop snoring? Right. On to my countdown of the best treatments. Number 1, lose weight. I know you will have heard this before, but if you can shift some pounds, this will take pressure off the tissues in the back of your throat. But what if you aren't overweight? Drink less alcohol before bed, or at least give yourself some time to sober up prior to sleep. And what if you don't drink? Sleep on your side. This helps keep your airway open. It's also why this is the recovery position in first aid. You can also try raising your torso with an extra pillow or by propping up the head of the bed by a few inches. Try to avoid medications that make snoring worse, like sleeping pills such as lorazepam, Ativan, and diazepam, Valium. Treat nasal congestion. If you have stuffy sinuses, do a saline rinse before bed. Try an antihistamine for allergies or a short course of intranasal steroids. Also consider a humidifier, which may improve swollen nasal tissues. Avoid smoking. The evidence is quite weak for this, unfortunately, but there are lots of great reasons to quit smoking, including improving your lung function. Surgery. There are various surgical procedures for snoring, although many of the techniques have not been formally proven to work for snoring in the long term, i.e. the snoring usually comes back. I'd suggest that you try some of my tips on devices and gadgets first before going down the surgical road. Devices, products, and gadgets. Okay, because there are so many products out there, I thought I'd group these into different categories. Like I said at the beginning, I'm not affiliated with any particular brand, so it's not a biased assessment. My take-home message for you is to get something which is comfortable so that you can wear it. It's often a bit of trial and error to get the best device for you. Firstly, there are nasal strips, and these are cheap and harmless, and you apply these adhesive strips across your nose at bedtime to help open up the nasal passages. These are good if the snoring noise is mostly coming from your nose. Nasal strips have only been shown to be effective in very small studies, so you may need to try it once to see if it works for you. Secondly, there are mandibular advancement devices. These pull your jaw slightly forward to open up the upper airway. You put the device in your mouth before going to sleep. These are known to be more effective if fitted specifically for your mouth by an experienced dentist and can cost around $2,000. There are cheaper do-it-yourself kits for about $40, but they may not be as well tailored to your mouth. Clinical testing of these sorts of devices have shown that some people get mouth dryness, teeth shifting, tooth discomfort, and jaw joint tenderness or stiffness. I'd advise this as an option if you don't have dental issues. Thirdly, there are tongue stabilizing devices, which are essentially silicone mouthpieces that gently pull the tongue forward through gentle suction. These don't cause jaw discomfort like the mandibular devices, but some might feel uncomfortable with the position of their tongue and notice more spit in their mouth. They range in price from $40 to $490 and are a good starting point because they are easy to use. Finally, there are chin straps, which are neoprene straps or bands that you put under your chin to hold your mouth closed during the night. This is to force you to breathe through your nose rather than your mouth. It works best for mouth snorers and also for people with dentures. In small studies, it has shown good outcomes, but again, you may want to try it out for yourself. They last for about 1 year. Because I love to learn new things, if I have missed something you think should have been mentioned, please write it in the comments for me, or let me know what has worked best for your snoring. Please give this video a like if you enjoyed it and hit the subscribe button for new videos every single week. Thanks for stopping by.